Jesse, I'll be your nurse today.
Hi, Jesse.
Just gonna close the curtain here for you.
Thank you.
Gonna do some hand hygiene.
Okay.
And the bed is locked in the lowest position, and 2 side rails are up as well. So, and can you remind me what your name is?
Yes, it's Irma Willis.
Willis, okay. And then how old are you, Irma?
I'm 65.
65, and your birthday?
It's July 6th.
6? Okay, perfect. And do you have any allergies?
No.
No allergies. Awesome. Okay, so I think what we're gonna do is we're gonna take some vitals on you first. Before that, I'd love to have you smile for me. Okay, symmetrical smile. And do you know where you are?
Yes, I do. I'm in the hospital.
In the hospital? Do you know what brought you to the hospital?
Yes, I'm on my vacation.
Okay.
Yes, so I'm not happy to be here. And about 3 days ago, I started having shortness of breath and coughing.
Okay.
Coughing up stuff. And every day the cough got worse and my chest got more sore because of the coughing.
Yeah.
So I decided I better come over and check and see what's going on.
Well, glad you did. We're gonna check
Yeah,
it
I
out.
am too.
We'll see what that is. I think we have the culture being sent to the lab too. Excuse me. And then do you know what month it is?
Yes, it's June.
It's June. Lovely June. And you kind of know what time of day it is, like morning or afternoon?
Well, I tell you, it's very hard to sleep in a hospital, so it's very hard to take, figure out what it is, but I think it's around lunchtime.
It's around lunchtime. You were right.
Okay.
You're absolutely right. So she is alert and oriented times 4. And then do you mind smiling for me? Okay, symmetrical smile. Facial symmetry is good. So I'm actually going to go ahead and start taking some vitals.
Okay.
And then can I also ask you if you're in any pain today at all?
Well, my chest hurts,
Okay.
so that's not comfortable when I cough. It hurts more.
You cough first more. And then what is the current pain scale? 0 being no pain and 10 being the worst. What would you rate it as?
I would guess like around a 4 or 5, which to me sounds like average.
Okay.
I think they did give me some medicine earlier, but I'm not sure.
Okay.
But it's at a point where I could live with it.
Okay. And is there a pain goal that you want it to get down to?
Yes,
What's
let's
that?
get it to 2.
52. Okay, we'll talk to the provider about that one. And I'm just gonna go ahead. I'm gonna take a pulse ox on you, so if I can get
Okay.
your lovely index finger.
Okay.
All right, thank you. And then while that's just reading, I'm just gonna go ahead and I'm gonna take your temp.
Sure.
See what you are reading as.
Okay.
Okay, 97.1 for that. I'm not sure if that turns it off. We'll deal with that in a second. And our pulse ox looks like it is 92 at room air, 92%. There we go. Thank you. And I'm gonna go ahead and I'm going to get some blood pressure from you as well.
Okay.
That's the hard part,
Nobody seems to like to do blood pressure. Even back home when I go to the doctor,
Yeah.
the nurse has to come out and do it. She always goes, "Oh, I hate this machine."
Yeah. It's not I don't think it's my preferred vital sign if you can
I
have
don't
it for-
think it is for anybody. Doesn't bother me, but I don't have to take it.
Let's see. I'm gonna go ahead and I'm gonna wrap this around your arm for me.
Okay.
I'm just gonna move this up a little bit. And just tell me if it's too tight or if we need to adjust it at all.
Okay.
The artery side has to be in there. So there's a fun little note on that as well. Okay. Sorry, I'm roll this up a little bit.
Sure.
Sorry, but this doesn't hurt you at all.
It does.
And you can just relax your arms too. You don't have to hold
Good.
up the whole time. Okay. My little stethoscope ready. That was a little bit of a trip, but that's okay. Alright, so. Is that tightening for you?
But it's not too tight.
Tight. Okay, I'm gonna do. There we go. And I'm actually actually just gonna go ahead and put my stethoscope right around here, okay? Actually, I think I'm gonna move it up a little bit.
Okay.
Sorry.
No.
Inflate you for nothing over here.
Yeah, it's all right.
I'm sorry.
Isn't that crazy?
It's come off, that's for sure.
I know.
Okay. Go ahead and like right here. And I'm gonna put my stethoscope right here ahead of time so we have less time. Good. You can rest it too, so I don't have to hold it up. Tightening up a little bit.
Mm-hmm.
Alright, thank you. I might have to retake that, but I got, I think, 110 over 80. Not so sure about the diastolic, but we can retake that if we need to. But thank you for letting me squeeze you for a minute.
Okay.
There we go. And I'm just going to go ahead and I'm going to check your pulses as well.
Sure.
Alright, keep that on me. So, let's go ahead. I'll have you do that for me if that's okay. I have about 60 beats per minute. And then, let's see, respiratory rate. We got temperature, we got oxygen, we got blood pressure, pulse, and then we're going to, I'm just going to count your respirations too. if
Sure.
that's okay. I'm just going to stare at you so it might make me a little uncomfortable.
Well, now I'm going to close my eyes because I'll have to make faces if I see you staring at me. Okay.
About 12 for respirations. And then I'm going to go ahead and we're going to do a cardiac, and we're also going to do a respiratory. Before that, what I like to do, I think we have a pen light here actually. Do we not have a pen light? Oh, thank you. It's pink too. We're going to start just kind of move down the body. That's what I like to do at least. So, what I'm going to do is I'm going to shine this light into your eyes, and then I'll actually have you take off your glasses if that's okay.
How's it going?
I have another question. Okay, so on number 10, it has ordered in supply, and then we have 10 milliliters. And ideally, you per hour, but you said
Are equal, round, and reactive to light, and then can you just follow this pen out? And to accommodation as well, okay? And I'm also going to inspect the inside of your mouth, if that's okay. If you just have you open wide for me. There we go, teeth look good. like that.
Thank you.
And then, do you wear, I saw that you wear glasses. Do you wear hearing aids either?
No,
Any changes in vision or hearing recently?
no.
No? Okay, perfect. So I'm just gonna look at your skin now too, if that's okay with you. So skin color looks normal. And then we also have, I don't see any edema or any presence of lesions at all either. Too. So I'm also gonna look at your nails. There's no clubbing. And then what I'm gonna do is I'm gonna do a capillary refill test. So I'm just gonna squeeze your thumb a little bit and just see how well that goes down essentially. Okay. So maybe that shouldn't hurt really. Okay. Capillary refill is about 2 seconds, so that's good. And then I'm also going to do a cardiac assessment on you too. And before I do that, do you have any tingling or numbness at all in your upper extremities? No?
No.
Okay, so let me check that really quickly. So for, oh, I'm sorry.
No, you didn't sit on me. It's the bed.
Okay, good. I'm going to have you squeeze my fingers really hard. I'm going to say 5 for that
Aren't you
one.
afraid someone's going to hurt you when they do that?
Not really.
Okay.
Not too bad, no.
Okay. It's me going home with sore fingers.
Yeah, I didn't hurt you at all.
Good. That's what I'm always afraid of.
Oh yeah. We need a cap refill test. I'm just gonna check your bilateral pulse again really quickly.
I like, okay, what is my dose? 100 milligrams times 18, that's my dose.
I'm gonna say probably a 3 on the pulses then.
And then if it changes,
And then do you mind if I assess your lungs and your heart? Okay, there's that for you.
I got 5 for this one, but I didn't, but it says divided.
Do those headlights run on batteries?
I think so.
Is
Yeah.
that what they run on?
Yeah. I think so. Can you start with the lungs, okay? Take some deep breaths in. I mean, it's a little bit hard right now.
But all in all, like, would you divide that into 2, right? Or like by 2? So we should be like divided
And I'm just gonna inspect. So for this lung part, it just has to be like right under your breast, if that's okay with you. So either can, yeah, if that's okay with you, I can help you with that.
Yeah.
There's this one over here too. Thank you. And then I'm just gonna have you like pull up your breast for a minute. If that's okay.
So this one.
Yeah.
That's the concentration.
Right under here too. And then I can go ahead and I can have you put your gown again on if you want to. I guess we could do the. Yeah, we'll do the back of the lungs really quickly too. I'm sorry, did I just scratch you?
No, you didn't.
I'm so sorry if I did. Okay.
No, you didn't.
I'm gonna need help sitting down. Okay. Let me see if I can roll the bed up a little bit.
Okay. Sweet, and then this one after.
Is that okay with you?
It's good.
It's good. Okay. And I'll have you lean forward just a little bit. Yes. Yep. Thank you. Good. I'll try to make this as quickly as I can.
Sorry.
You're okay.
I'm sorry. Okay.
Perfect. Thank you so much for letting me do that. You can go ahead and sit back now if you want to.
Janet has allergies.
Oh.
Irma does not.
Oh, okay.
So
Sorry.
No, I'm sorry for coughing.
No, that's okay. You don't have to apologize for coughing. I'm gonna take a listen to your heart though.
Okay.
So I might have you might have to roll down your gown again, just because we might have to do a fun little lifting again that I know. Here, I can help you with that. that for you. Do this one too. Okay.
Sure.
Okay, so I'm going to first assess the aortic, and then pulmonic. And then we've got Erb's point, mitral, and then I'm just gonna have you lift up your left breast for me, if that's okay. It's gonna be tricuspid then for that one. Okay. Thank you so much. I'll help you put your gown back on. And then she also did have a good respiratory effect, and the rhythm of the heart was normal too.
If you ever see somebody doing this a lot, which is what you'll see me doing,
Yeah.
that means allergies.
Does it?
That's what my allergy doctor said to me about little kids. They do this.
Oh.
That means allergies.
I wondered about that before. I'm like, why do little kids always do that? Is it just because they?
It's because they have allergies. And it's amazing how many little kids do it.
Is it?
Because, you don't teach your kids to do this.
No.
You say to them,
Yeah, exactly.
Yeah.
That's true. So next what we're gonna do is we're gonna do a GI assessment.
okay.
So what we can do is I can either do it over your gown or you can raise your
Yeah.
gown, whatever you are comfortable with.
Yeah, that's
So, okay, perfect.
Do you want me to lay down a little or not?
We can if that's okay with you. I'm gonna put it back for just a little bit.
Yeah.
And you just tell me if that's not comfortable or not.
That's good.
That's good. Okay. So
Thank
what I'm
you.
gonna do is I'm just gonna raise this up a little bit, okay? And I'm gonna be assessing all 4 quadrants as well. I'm gonna auscultate first. So bowel sounds in all 4 regions. And I'm now going to palpate the areas as well. So I'm just gonna lightly press down on them too.
Okay.
If it hurts, just bellow at me.
I will.
Okay.
No. Nope. And okay.
And then when was your last bowel movement?
Oh, excuse me. I told you I was tired.
That's okay.
My last moment, I think, was 2 days ago.
2 days ago?
Yeah.
And then do you remember kind of like the color of like it was a hard or soft stool?
Well, it was a hard stool and it was brown. And normally I go every day, but I have not been eating well. I haven't been hungry.
Being hungry, that makes a difference.
Yeah. So I don't know, but that's where I'm at now. 2 days ago.
That would make sense. Do you have any problem urinating at all? Can you do that? Okay. Awesome. Well, what we're gonna do now is we're gonna move towards the end of the body.
Okay.
So like we're getting near the end of it. We're almost out of the woods. Do you have any numbness or tingling in your lower extremities?
I don't.
No. Okay. Perfect. So I'm just gonna go ahead. I'm gonna roll these up for a minute. Make them look cold. So skin looks good. The color looks normal. I don't see any presence of edema or lesions. Do you mind if I take your socks off as well in a minute?
You go right ahead.
I'm gonna go ahead and I'm gonna check the pedal pulses too. And I'm gonna say that's like a
Thank you.
4 strength. And I'm gonna have you push up against my hands really quickly. There we go. Sorry, that was kind of I can move the table to maybe that would be better. Have you push up against my hands?
Uh-huh.
Okay, and then against. There we go. Awesome. So yeah, I would probably note the strength around that is 5 as well. And then I'm gonna take off your socks for just a second. And I'm just gonna do that same thing I did on your thumb, just to make sure. Okay, capillary refill looks good, about 2 seconds. I'm just gonna go ahead and I'm gonna put your sock back on for you and get you all covered up. So no numbness or tingling?
No.
Okay. All right. right. Well, what are your goals for today?
To get me leveled down and stop me from coughing so much.
Okay, awesome. We can definitely work on that. I know the doctor is gonna come in too. And then, do you have a good support system?
Oh yeah. Back home I have a brother and a sister,
Brother and sister. Oh, good.
and I have a dog.
You have a dog.
Yes, it's the best support system.
What kind of dog do you have?
It's a Australian Shepherd.
Australian Shepherd. I had a Labrador for a long time.
Oh, did you? Oh, they're so beautiful.
They're very sweet.
Yes, they are. Big.
We love Labradors. And then any anxiety, I know it can be kind of hard, especially
I'm just annoyed.
just annoyed. Okay.
You know, I'm not like scared or anxious. I'm just annoyed that it had to happen while I was on vacation.
Yeah, no, that's the worst.
Yeah.
Um,
But no, I'm fine because I know I'm gonna get better,
yeah.
and then I
You
can
will.
go home.
Yeah, you will. And you know what? You'll get back to your vacation too.
Well, maybe. Maybe I'll just go home.
Yeah, maybe relax when you're at home.
Yeah.
I do have the call right here if you need me.
Thank you.
And the bed is locked in the lowest position. I'm just gonna make sure that's actually the lowest position. I think it's in the lowest position. Do you need me to change it at all? Perfect. And then, do you have any questions for me at all?
No, thank you.
Okay, awesome.
You were very sweet.
Oh, thank you.
I appreciate that.
Thank you. I appreciate that. I know that's not your real name, but okay. Thank you.
You're welcome. Bye.
Bye.